Hi everyone, welcome back to my YouTube channel, and today we are going to talk about eyelid anatomy. So let's start our topic with introduction. Eyelids, that are also called as palpebrae, are movable folds of skin that cover and protect the eyeball. They help in protection of eye from injury, foreign bodies and excessive light. And also they spread tear film over the cornea, and drainage of tear is through the lacrimal apparatus. Each eyelid has an anterior, that is skin side, and posterior, that is conjunctival side, with complex structures in between. Layers of eyelid. From superficial to deep, the eyelid consists of five main layers. They include skin, subcutaneous tissue, muscle layer, fibrous layer, that is also called as tarsal plate, and conjunctiva. So first layer of eyelid is skin. It is thinnest skin in the body. It lacks subcutaneous fat that allow free movement. It contains fine hairs, sebaceous glands, and sweat glands. Second layer of eyelid is subcutaneous tissue, that is loose connective tissue and allows swelling in case of inflammation, trauma, and allergy. Third layer of eyelid is muscle layer, that may be orbicularis oculi muscle, that is palpebral part that closes eyelid. It is work under the influence or innervation of facial nerve, that is seventh cranial nerve. Second muscle is levator palpebrae superioris, that is present in the upper lid only. It elevates eyelid and it is supplied by oculomotor nerve, that is third cranial nerve. Third muscle of the eyelid is Muller's muscle, that is also called as superior dorsal muscle. It's the smooth muscle that assists in eyelid elevation during it is supplied by sympathetic innervation. Layers of eyelid. Fourth layer is fibrous layer, that is also called as tarsal plate. It is dense fibrous connective tissue that provides shape and firmness. It contains meibomian glands that are also called as tarsal gland that secrete oily layers of the tear film. Fifth layer of eyelid is conjunctiva. It is the mucous membrane that line the inner eyelid. It reflects onto sclera as a bulbar conjunctiva. It contains globular cells that secrete mucin for tear film. Specialized structure of eyelid include eyelid margins. Each eyelid has anterior margin and posterior margin. Anterior margin has eyelashes and they are associated with sebaceous gland and sweat glands. Sebaceous glands are also called as gland of Zeiss, and sweat glands here are also called as glands of Mohs. And then it has posterior margin that has the opening of meibomian glands. Then there is medial and lateral canthi of the eyelid. They are angled where upper and lower eyelid meet. Medial canthus contain lacrimal lake, that is small pore of tears, and lacrimal carunculi, that are small pink nodules with sebaceous glands. And plica semilunaris, that is fold of conjunctiva, that is vestigial necessitating membrane. Palpebral fissure. It is the opening between upper and lower eyelid. It is normally 10 mm vertically and 30 mm horizontally. Blood supply of eyelid. It is supplied by arteries that are branches of ophthalmic artery, that are medial palpebral artery, and it is also supplied by branches of facial artery, that is lateral palpebral arteries. Vein drainage is drained into ophthalmic and facial vein. That is clinically important because it leads to danger triangle of face, and if there is infection it can spread to cavernous sinus. Nerve supply of eyelid. It has motor nerve supply to orbicularis oculi muscle, that is by seventh cranial nerve, that is facial nerve. It has second motor nerve supply, that is by levator palpebrae superioris, that is by third cranial nerve, that is oculomotor nerve. It has a motor nerve supply to Muller's muscle, that is by sympathetic innervation. Then it has sensory nerve supply, as upper eyelid is supplied by ophthalmic division of trigeminal nerve, and lower eyelid is supplied by maxillary division of trigeminal nerve. Lymphatic drainage of eyelid. Lateral part of eyelid is supplied by preauricular lymph nodes. Medial part of eyelid is supplied by submandibular lymph nodes. Clinical significance of eyelid anatomy. First is dye, that is also called as hordeolium, that is acute infection of sebaceous gland. Second significance is chalazion, that is chronic blockage of meibomian gland. Third significance is ptosis, that is drooping of eyelid, that is due to third cranial nerve palsy that causes levator weakness, and Horner syndrome that causes Muller's muscle paralysis. It is also because of myasthenia gravis. Fourth significance is blepharitis, that is inflammation of eyelid margins. Fifth significance is lid laceration that must be carefully sutured due to gland involvement. Conclusion of this lecture video. Eyelid is highly specialized structure that is composed of multiple layers that function together to protect and lubricate the eye. Understanding its anatomy is essential for diagnosing and treating common ophthalmic and neurological conditions. And this was all about eyelid anatomy. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.